Oh, kia ora, hene, kei te pēhea koe.
Kia ora. I have some questions about the vaccination.
What are the most important things that Māori communities need to know about the vaccination for corona?
It's really important to understand that our own safety criteria from MedSafe have been met, but also I think that we need to think about the bigger impact that coronavirus has had on us in Aotearoa, but also on the world. Think about our whānau in Australia and how hard it has been to be separated for them for so long. We have whānau around the world, and we'd like to be able to see them again.
What is your response to whānau? Noho ana I runga I te taiapa.
He pāpai noi ho tēnei. Are we used as test subjects for this vaccine?
I think there is concerns from people. I've heard that it's been very fast and that we can't have enough information about this vaccine. What we've seen with coronavirus is there's been a worldwide pooling of resources. Lots of money has been put into this mahi, but the technology isn't new. The technology for mRNA vaccines has been developed over at least a decade, and then our knowledge of vaccines and how they work, you know, we've been giving those for almost a century. Even though we might be the first in Aotearoa, millions of doses of this vaccine have been given around the world, and so we can learn from their experiences. Some people are just worried about the needle. You know, we will do whatever it takes to make it as comfortable as possible. And so if you need to lie down, if you need to have it in a specific place, if you need someone there to hold your hand, kai te whakaera mea katoa.
Will the vaccine be effective for kaumātua who have various health issues or those that are on long-term medication?
Is 65 the right age for Māori?
Kia nei, he timatanga noa tērā. You know, we've got to start somewhere. Everybody who has those long-term conditions can have the vaccine. How effective it is really depends on each person's immune system. If they have a strong immune system, then they will have a strong response. If they have quite a weakened immune system or they're immunocompromised, the response won't be as strong. But we're still happy for those people to have the vaccine. We are really wanting to protect our whānau that need the vaccine and are going to benefit the most in terms of if they got COVID, they would get more sick. And so e rua ngā taha o taua reanga tuatahi, the people over 65, but also people who have long-term medical problems such as diabetes or heart disease, cancer. Everybody who is more likely to get very sick if they get COVID can get the vaccine first.
Oh, ka pai hoki tērā, rawe.
How do we ensure that our people are getting, so that they can make an informed choice, that they're getting credible information?
As Māori health providers, I think that's a big role that we have in terms of supporting our own whānau so that they can feel comfortable about their decision to get the vaccine.
I really get that, and I think, you know, he mihi nui ki a koutou, nā ratonga hauora, me a koutou mahi, but I also think that there are whānau and individuals who don't necessarily engage with those services and they've had bad experiences in the past. How do we ensure that the services are able to engage with those people?
Some of that is about being he kanohi kitea, that you actually have to turn up to have the kōrero, and that means that we have to have multiple strategies to be able to reach our whānau. We need to be able to do home visits, we need to be able to do mobile clinics, we need to be able to do outreach, all these different mechanisms that we've really got strong at in the last year because of the way that we've had to do the testing for coronavirus. I feel like we've got all the tools and now we just need to get the vaccine and get going.
Awesome.
Kia ora, Lily. Thank you for that information. The advice that you're given is valuable to our people.
Me te kaunga hoki o tō mōhio tēnā koe.
Kia ora.